probably the exception to the blue zones enjoying great sunlight. Well, it's important to get vitamin D levels adequate. Now, you can get adequate vitamin D levels with sun exposure. In fact, a very famous professor from Boston University, Dr. Hollick, who is a dermatologist, became notorious a number of years ago by recommending that people spend 15 to 20 minutes a day exposing themselves to sunlight. And I won't go into all the mischief he got into by saying that, but he's subsequently been proven correct that sunlight exposure is very important. Now, when you expose your skin to sunlight, you will make the active form of vitamin D, which is vitamin D3. And that's important because the good news is swallow the same vitamin D3 as a supplement without having to expose yourself to the sun. Vitamin D is a critical vitamin. It's actually a hormone more than a vitamin that is critical for our immune system functioning. It's critical for our brain functioning. In fact, depression has been linked to low levels of vitamin D. It's incredibly important during pregnancy. A study out of South Carolina reported that gestational age was influenced by a mother's vitamin D status, and that infants that were born prematurely were in moms who were vitamin D deficient. So if you're thinking about getting pregnant, if you're pregnant, make sure you're getting adequate amounts of vitamin D, and we'll talk about that in a moment. Vitamin D deficiency also increases the risk for muscle weakness and frailty. Vitamin D is essential to actually keep our gut wall intact. There's very fascinating studies that vitamin D promotes stem cell proliferation in the wall of our gut. And if you've been following the excitement about stem cell research, you know that having activated stem cells is probably a pretty good idea. We also know that people who have the highest levels of vitamin D tend to live the longest, not only live the longest, but live the healthiest as they age. So a lot of good reasons to keep our vitamin D levels high. Now, there's a fallacy out there that because vitamin D is a fat-soluble vitamin, that you have to eat fat when you swallow vitamin D to absorb it. And in fact, Professor Hollick in Boston showed in human experiments that there's no need to have fat in your diet to absorb vitamin D. In fact, you can actually find powdered vitamin D capsules with no fat, and they're perfectly acceptable, although most vitamin D capsules are in a fat capsule. But the point is, you do not have to eat a fatty meal. You don't have to have an avocado when you swallow your vitamin D capsule to make it absorbable. Yes, it is a fat-soluble vitamin, but that doesn't mean you will not absorb it without having fat in your diet. It's one of the great vitamin D myths. All right, how do you know if you're getting enough vitamin D? Well, sun exposure is one way of basically assuming you're getting a baseline level. But it takes a significant amount of sun exposure to get an adequate level. Most people can achieve a vitamin D level of 50 to 60 nanograms per deciliter with about an hour of sun exposure per day. But remember, that's 365 days a year, and I can guarantee you most people aren't getting that much sun exposure unless you're Joseph Mercola. On the other hand, many people unfortunately don't have the right vitamin D receptors on their cells, so that even some people who get a lot of sun exposure don't have adequate levels of vitamin D. So first of all, get your vitamin D level measured. It's a simple test, it's cheap, any doctor can order it for you. Now, the federal government's levels are incredibly low. They say that 30 is normal and that only in the 20s are you deficient. In my practice, I want people to have vitamin D levels around 100 to 150. If you have a Quest lab or a Cleveland Clinic heart lab, they will tell you that a normal vitamin D level is up to 150. The University of California, San Diego